Dr. Tesfaye has touched points on how to improve epilepsy service within Africa context and specifically Ethiopian context. And I will be looking at on the importance of education into improving the service of epilepsy. So just want to give you a quick guideline of what, I'm going to present about specifically about Care Epilepsy, what we do, our vision, mission, and then the impact of having no education or less knowledge about epilepsy, what the result is, mainly the stigma being, and how stigma affects the lives of people who live with epilepsy. So Care Epilepsy Ethiopia, which is the charity that I've founded, is a small epilepsy-focused grassroots charitable organization in Ethiopia. We're the only organization there working on the ground level with communities and grassroots levels. So that's who we are. And then we're also a referral center for epilepsy. So we do give some basic clinical service, but we do refer to tertiary hospitals and specialist care. And basically, we were founded, or Care Epilepsy was founded to raise awareness about epilepsy, to promote the interest of people with epilepsy. As we've already seen some of the questions that we raised in the previous presentation, there's a lot of stakeholders who need to be involved in improving epilepsy service in Africa. So we are here to promote the interests of people with epilepsy, to improve their welfare of the patients, and to build partnership with other stakeholders. One thing that I've learned through my 7 years of working with people with epilepsy, or facing the challenges of epilepsy in Ethiopia, is it's not a job that one organization can do. It takes it truly takes a village to raise a child in this context to improve the epilepsy service. And also we're involved in contributing data and information to research and building institutional capacity. So our vision is to see people with epilepsy protected, respected, healthy, enjoy life, free from discrimination and stigma, and achieve the best mental wellness so that they can be productive citizens. So this is very important to us. It's not about every person with epilepsy achieving, going to university and getting their MBA. It's just achieving to become productive citizen and achieving what they are able to achieve as an individual. And our mission is to save lives and change the perception of epilepsy. We are an inclusive sorry, can't see it here. As our values, inclusiveness is important for us, and to give respect and dignity for people with epilepsy, and partnership is three important values in our organization. So when we look at our objectives, the first one is to facilitate medical care and treatment. Secondly, to increase public education and awareness about epilepsy, and then to improve the wellness of people with epilepsy, and fourthly, advocacy in partnership. So basically what I want us to focus today is about the impact of lack of education. So Dr. Tesfaye has mentioned about the misconception of epilepsy in Ethiopia and in Africa, that it's contagious, that it's evil spirit, something to do with the evil spirit, witchcraft, and that a lot of them think there isn't any medical cure for it. And again, treatment reliance is on traditional healers, holy water, and prayer, so forth. And so these beliefs permeate throughout society, even into the professional world. I've had experience with that people who are educated and do, very important jobs. And yet when it comes to epilepsy or their children, they are looking for traditional healers and other method of getting cure or getting treatment for their children or their child, instead of going to medical facilities. So it's not just only the uneducated one, but even those educated one, there is a huge information gap. So this lack of understanding about epilepsy suggests the necessity of providing information. For us, it is education, 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 and education again. So we said, okay, there's information gap, but what is the impact of stigma on the physical health of a person or a person with epilepsy? So epilepsy is a major source of death and disability in Africa, and that is due to uncontrolled seizures. What Dr. Tesfaye has mentioned already about although it's not to the standard that we want to have, we do have epilepsy service, but the worry is it's not just having the medication or the service, it's about actually experiencing seizure control so they can live a productive life. So that is always the challenge in Ethiopia. I don't know how much that reflects in other African countries. But it's important to note that uncontrolled seizure means physical injuries, such as, for example, burns. These are women that we've come across in our work. And then more than the physical injuries, also, there is a huge impact on the mental health of the person living with epilepsy. So there is exclusion from social life, there's exclusion from education, exclusion from employment, and that exclusion builds into developing mental health issues. A lot of people in Ethiopia, people with epilepsy, get their treatment in mental health institutes because of mental health being a comorbid condition, or even if they don't have mental health as an issue, the service is given within mental health hospitals. Again, education, when we look at the impact of stigma on education, a lot of children in Ethiopia are not attending schools, children with epilepsy. So here, it's two things really. One, parents and the teachers or the community in general don't consider these children to be able to have an intellect to actually learn. So they think if you have epilepsy, you're not able to learn. So that is one problem. Secondly, teachers and schools are not equipped to deal with children with epilepsy. So the way they deal with that is excluding students or children to attend school. So Care Epilepsy has been working in close connection with the Ministry of Education and with various schools and giving training to teachers and school nurses to empower them to be able to deal with children with seizure. And it's just to open, to make access for the children with epilepsy to attend school. And then again, when we look at the impact of stigma, that is the impact of having, a knowledge gap about epilepsy, that also is reflected on the economic status of the individual with epilepsy. A lot of people with seizure, with epilepsy, they have lower employment opportunity. And families also, one of the parents relinquish paid employment in order to care for the person living with epilepsy, because there isn't any government supported centers or supports to keep people with epilepsy Yes, to keep people with epilepsy. So they have to relinquish paid employment. Many adults with epilepsy, if they are appointed a job, then it is mostly a daily worker's job. So the money they receive from there is not, major to make to make a difference in their lives. So that is, come and go, nothing secured. In a study done in Ethiopia, in one of the rural communities in Ethiopia, it shows that out of 1,250 inhabitants, 46% responded that they would not employ people with epilepsy. And that means these people are destined for life of poverty. So another issue, when we look at another issue that's related to having poor knowledge or the knowledge gap, stigma when it comes to epilepsy, is it causes a lot of homelessness. I don't know whether that reflects in other African countries, but certainly in Ethiopia, poverty and dependency on family means sometimes, or in most cases, that not actually the children and the adults being pushed out of the house or the home of the family and living on the street. These are children that we came across, homeless children who were left by the door of a Catholic church mission in Jimma, one of the large cities in Ethiopia, with no family history to trace, because they have epilepsy. So literally they were just left on the road. So this stigma that is related to epilepsy has huge negative effect on the lives of people with epilepsy. So when we look at care epilepsy strategies to public education and awareness creation, we use various types of strategies. One, we run epilepsy education sessions at hospitals, health centers, schools, organizations, and run various campaigns. So that has been very effective because you actually meet the community at health centers, at hospitals, and then when we go to schools, we get the opportunity to meet the children and teach them seizure first aid, and teach them that if they come across to a child or anyone with epilepsy, with seizure, that is not contagious. They can help the person, and to make them understand that other children with seizures are just as capable of learning as they are when it comes to education. And we hold various campaigns as well. Other work that we do when it comes to our strategy to raise awareness and increase education is partnership with other stakeholders and involving programs such as international and continental epilepsy awareness campaigns, and then designing course for educating people with epilepsy and those supporting people with epilepsy. Again, as I said earlier, it is very important that we work in partnership. That's what we believe in. We can only grow in partnership and have the capability to reach out to a vast number of people. And also we leverage mainstream media, social media, such as online community forums, post chats, Twitter, Facebook, and website as other countries to increase awareness of epilepsy. We also give provision of information about epilepsy in the form of hotline, newsletters, posters, leaflets, and we have set up a resource center that's open to anyone, to the public, anyone affected by epilepsy. We also have found it to be useful to translate educational materials in local language. In Ethiopia, Amharic and Oromiya is the largely spoken language in the country. So we've done educational leaflets and brochures in both languages, and we aim to include more of other languages, because it's very important that our education strategy takes into consideration culture, language, and customs of the area that we are giving the intervention to. And again, the course design, we have a course designed for educating people with epilepsy and those supporting people with epilepsy. So this is one of the pictures, us basically teaching in schools, and this lecture given to the students, the teachers, and the school nurses. Again, different schools, and as you can see, we actually teach first aid, as you can see here. So they actually know what to do, how to give first aid for seizure. And again, training here, and also campaigns that we run every year. And we use that, normally we have it in February. And that is another exciting program that involves the community, where we do a one-week campaign using radio, TV, social media, and actually giving trainings and street campaigns. And normally at the end, we have walk to commemorate the end of the week. So that is another way of increasing education to fill in the gap and to encourage people to go and receive medical care. That is the most important thing, and to increase social acceptability. And this is again in different parts of Ethiopia where we've gone to teach, raise awareness. And what I said at health centers, again, it's just giving the time to the community. When they come there, they're basically waiting to see a doctor, and we just utilize that moment that they have sitting waiting to see the doctor. So that has been a very effective way of doing our work. Again, working with faith leaders, it is very important, and the community leaders, and using media personnel as well. So these are the different posters that we use in our language to teach about epilepsy, to increase their knowledge, community conversation. So in conclusion, why do we need education in epilepsy? So really it's 4 points. One is to become, so they can become seizure free, or at least have controlled seizure that they can live a productive life. And secondly, it's to increase social acceptability. And thirdly, to eradicate poverty of people with epilepsy, because we can't expect them to always live waiting the hands of the family or the friends. So we just want to get rid of that poverty, and also to decrease mental health issues related to epilepsy. So thank you very much. Care Epilepsy is changing the face of epilepsy in Ethiopia, and our message is, yes, you can with epilepsy, you can be a productive citizen. And we really believe more awareness means more acceptance. Thank you. So if anyone has any question for me, or want to give comments, I open the floor to you.